Hello everyone, I am Dr. Kuber Sharma. So guys, if we consider nowadays in today's world, if we consider post MBBS options abroad, that is USA, UK, Australia, New Zealand, at the present time right now the best option is Australia. You would be wondering why. The reason behind this, in Australia, after completing the first step of the examination, that is AMC-1 Australia Medical Council Examination 1, you can work as a junior doctor there for a house job as a junior resident in Australia. None of the other country like USA or UK, if you want to work as a doctor, you need to complete all of the process and all the steps. Likewise, like in USA, you need to complete USMLE step 1, step 2, CK, and after that you will do matching, and after that you will be selected as a doctor and you can work as a doctor. Same way like in UK, earlier it was PLAB, now it is a UK MLE. You need to clear UK MLE step 1, then step 2, then you can work as a doctor. But not in Australia. In Australia you can work as a junior doctor after completing the first step, that is AMC step 1. And the second thing is, AMC is the only examination which can help you to work as a doctor and earn money just in 1 year. You can become a resident of Australia in 1 year. You can apply the residentship in Australia after completing AMC step 1. The AMC step 1 examination you can make an attempt in your own country. If you are in India, you can give examination in your cities, like in North India you can give in Chandigarh, Delhi, and there are 13-14 other centers all over the country. This examination takes place every month of the year except for December and January. And you can take the attempt any number of the attempts, like nth number of the attempt. There is no cap that only this much attempts are allowed. The AMC step 1 is 3.5 hours long exam. In the examination there would be 150 questions and the pattern of the exam is MCQ pattern. There will be 5 options of the questions. In the 5 options, or even the 2 options would be irrelevant and the remaining 3 would be related to the question. So you need to rule out the incorrect one and you need to choose the appropriate answer for your question. So it is not a very difficult examination. The main thing I want to talk about is it is not a competitive exam. Guys, it is not a competitive exam. You need to just pass the exam. It is a passing examination. You need to only score 50% of the marks and you can work as a doctor in Australia. And the most amazing thing about the examination is there are no preclinical subjects in the examination. There are only clinical subjects, likewise being surgery, medicine, obs, gynae, pediatrics and community medicine. These are only subjects which are included in the examination. So guys, if we talk about question division subject wise, it would be as following: 30% would be adult health and medicine, 20% would be adult health and surgery, 12.5% would be obs and gynecology, 12.5% would be adult mental health or psychiatry, and the remaining would be community medicine or population medicine. To get promoted, you need to give further examinations, that would be WBA exam and clinical examination. The pros and cons of this examination we will discuss in the video ahead. You need to and you must to attempt all 150 questions as there is no negative marking. And the main thing to remember in the examination is, if you attempt the question once and you skip to the next question, you are attempting the next questions and you think that I will go back and change the answer, it's not possible. You cannot change the answer or you cannot withdraw the answer once you have attempted. So before attempting the questions, be careful and be specific. First read the question, then read the answers, then think and then take, because it would be the last attempt of the particular question. The algorithm of AMC Step 1 examination is quite different than the other examination. If you consider about the examination, the initial questions would be very easy. Then if you attempt the first question, the second would be tougher or harder. And in the consecutive next coming questions will become more tough and more hard. So the level of toughness keeps on increasing with the number of the attempts, like number of the questions you have attempted. But the main thing is that these are all clinical questions, all the clinical subjects. These you have already read in your clinical years. That is not a long ago. So I mean to say, if you start studying from now, at least 7-8 hours a day from starting, then to 10-12 hours a day, it is only a time of 7-8 months in which you can pass the examination and become a doctor in Australia. So guys, this is all about AMC Step 1. All the other information, the registration, the ECFMG registration, the Epic account, the fees, the price, and each and every step we will discuss in the upcoming videos. All we will discuss in details and in full clarification. So guys, if you like this video, do subscribe to my channel and do share it with your friends who are seeking to become a doctor in Australia.